The fluorescent lights buzzed overhead as Angela walked down the hospital corridor, her soft-soled shoes making barely a sound on the polished floor. After 15 years of working at St. Mary's Hospital, she knew every corner of this place like the back of her hand. But today felt different. There was tension in the air that she couldn't quite shake off. She stopped at the nurse's station where her colleague Lisa was frantically typing notes into the computer. Lisa looked up with tired eyes and let out a long sigh. "Angela, thank goodness you're here. We have a situation with room 314. Angela raised an eyebrow. Room 314 had been occupied for 3 weeks now by an elderly patient who had come in with severe diabetes complications. She had heard whispers about him in the break room, but hadn't paid much attention to the gossip. "What kind of situation?" Angela asked, setting her bag down on the counter. Lisa glanced around to make sure no one else was listening, then leaned closer. "It's Mr. Harold. He's been giving everyone a really hard time. 3 nurses have already asked to be reassigned from his case this week alone." Angela had worked with difficult patients before. In her experience, most of the time when someone was being difficult, there was usually pain or fear behind it. "What exactly is he doing?" "Well," Lisa hesitated, "he's been saying some pretty awful things, particularly to the black staff members. Janet tried to help him yesterday and he completely lost it. Started yelling and saying things that made her cry." Angela felt her jaw tighten. She had dealt with prejudice before in her career, but it never got easier. Still, she had always believed that everyone deserved proper medical care regardless of their attitude or beliefs. "Has anyone tried to understand why he's acting this way?" Angela asked. Lisa shrugged. "Honestly, most people just want to avoid him now. Dr. Peterson has been asking around to see if anyone is willing to take over his care, but nobody wants to deal with the drama." Angela looked down the hallway toward room 314. The door was closed and she could see the "Do Not Disturb" sign hanging on the handle. She wondered what was really going on with this patient. In her 15 years of nursing, she had learned that angry patients were often scared patients. "What's his medical condition like?" Angela asked. "His diabetes is pretty severe. He needs regular monitoring, help with mobility, and medication management. The thing is, he refuses help from most of the staff. Yesterday, he wouldn't let anyone check his blood sugar for over 6 hours because he didn't like who was assigned to him." This concerned Angela more than the reports of difficult behavior. A diabetic patient who wasn't getting proper monitoring could end up in serious trouble quickly. Just then, Dr. Peterson approached the nurse's station. He was a kind man in his 50s who had always treated Angela with respect and professionalism. "Angela, I'm glad you're here. I wanted to talk to you about Mr. Harold in room 314. "Lisa was just filling me in on the situation," Angela replied. Dr. Peterson looked uncomfortable. "Look, I'll be straight with you. This patient has been extremely difficult with several staff members, and his behavior has been particularly problematic toward our minority nurses. I don't want to put you in an uncomfortable position, but honestly, you're one of our most experienced nurses and this patient needs proper care." Angela appreciated his honesty. "What exactly are you asking me, Dr. Peterson?" "I'm asking if you'd be willing to take over his care. I know it's not fair to put this on you, but I'm running out of options. His health is deteriorating because he keeps refusing treatment from the staff we assign to him." Angela thought about this for a moment. Part of her wanted to say no. Why should she subject herself to abuse when other people were refusing to deal with this patient? But another part of her, the part that had gotten her into nursing in the first place, knew that this man needed help whether he wanted to accept it from her or not. "What's his background?" she asked. "He's 78 years old. Lived alone for several years. His diabetes has gotten worse over the past few months, and he was brought in by paramedics when his neighbor found him unconscious in his apartment. No immediate family that we can contact." Angela felt a pang of sympathy. An elderly man living alone with serious health problems. That sounded like someone who might be scared and taking it out on the people trying to help him. "I'll take the assignment," she said finally. Dr. Peterson looked relieved but also concerned. "Are you sure? I don't want you to feel like you have to do this." "I'm sure. but I want everyone to understand that if his behavior becomes abusive, I'll document everything and we'll need to address it properly. Absolutely. And Angela, if you need any support or if things get too difficult, just let me know immediately. As Dr. Peterson walked away, Lisa looked at Angela with a mixture of admiration and worry. Are you really going to do this? You know, what he's been saying to people, right? Angela nodded. I've heard. But Lisa, think about it. Here's an old man, sick and scared, probably feeling like he's lost control of everything in his life. Sometimes people lash out when they're frightened. But the things he's been saying, I know. And I'm not excusing that behavior. But I also know that refusing to care for him isn't going to help anyone. He needs medical attention, and I'm a nurse. It's what I signed up for. Lisa shook her head. You're braver than me. I heard Janet crying in the bathroom after her shift yesterday. Angela felt angry about that. No one should have to deal with abuse at work, and she made a mental note to check on Janet later. But she also knew that walking away from difficult patients wasn't the answer. She picked up Mr. Harold's chart from the desk and began reading through his medical history. His diabetes had been poorly managed for years, which explained some of his current complications. He had high blood pressure, some kidney damage, and problems with circulation in his legs. This was a man who needed consistent professional care. As she read through the notes from previous shifts, she could see the pattern. Medication times missed because he refused to cooperate. Blood sugar checks delayed. Physical therapy sessions canceled because of his behavior. His health was getting worse, partly because his attitude was preventing him from getting proper treatment. Angela closed the chart and looked down the hallway again toward room 314. She had no idea what she was walking into, but she knew one thing for certain. This patient was going to get the best care she could provide, regardless of how he treated her. She straightened her shoulders, took a deep breath, and began walking toward his room. As she got closer, she could hear the television playing loudly inside. She knocked gently on the door and waited for a response. "What do you want?" came a gruff voice from inside. "Mr. Harold, my name is Angela. I'm your nurse for this shift. I'd like to come in and check on you." There was silence for a moment. Then she heard him mutter something she couldn't quite make out. She decided to take that as permission and gently pushed open the door. The room was dimly lit, with the curtains drawn tight against the afternoon sun. Mr. Harold was sitting up in bed, a thin man with white hair and tired eyes that immediately narrowed when he saw her. "I already told them I don't want any help from people like you," he said coldly. Angela felt the sting of his words, but she kept her expression neutral and professional. "I understand you've been having some concerns about your care, Mr. Harold. I'm here to make sure you get the medical attention you need." She could see him studying her, probably trying to figure out how to get rid of her like he had the others. But Angela wasn't going anywhere. This man needed help, and she was going to provide it one way or another. Angela stepped into the room and quietly closed the door behind her. The smell of disinfectant mixed with the staleness of a room where the windows hadn't been opened in weeks. Mr. Harold glared at her from his hospital bed, his arms crossed, tightly over his chest like a shield. "I said I don't want your help," he repeated, his voice sharp and cutting. Angela moved slowly toward the bedside table where his chart lay open. "Mr. Harold, I can see from your records that you haven't had your blood sugar checked in over 4 hours. That's not safe for someone with your condition." "I don't care what you think is safe," he snapped. "Get out of my room and send someone else." Angela pulled up a chair and sat down, which clearly surprised him. Most people would have left by now, and she could see the confusion in his eyes. "I'm not going anywhere," she said calmly. "I'm your nurse today, and I'm going to make sure you get the care you need." For the next several minutes, Mr. Harold unleashed a stream of harsh words that made Angela's chest tighten with hurt and anger. He questioned her education, her abilities, and said things about her race that she had hoped she wouldn't have to hear in a professional setting in 2024. But Angela had dealt with difficult people before. She sat quietly, letting him wear himself out with his anger, and when he finally stopped talking, she simply said, "Are you finished?" He stared at her, probably expecting her to storm out or argue back, Instead, she stood up and reached for the glucose monitor on his bedside table. "Whether you like me or not, your blood sugar still needs to be checked," she said matter-of-factly. "You can cooperate and make this easy, or you can fight me and make it harder. But either way, it's going to happen." Something in her tone must have gotten through to him because he didn't pull his hand away when she reached for it. His skin was cool and slightly damp, which concerned her. She pricked his finger quickly and efficiently, the way she had done thousands of times before. The number on the monitor made her frown. His blood sugar was dangerously low, which explained some of his irritability and confusion. "When was the last time you ate something?" she asked. "I don't want the food here. It tastes terrible." Angela looked at his untouched breakfast tray on the rolling table. The eggs were cold and congealed, the toast was hard, and the orange juice had a film on top. She couldn't blame him for not wanting to eat it. "Mr. Harold, your blood sugar is at 65. That's too low. You need to eat something right now, or I'm going to have to give you glucose through your IV." She could see him weighing his options. He clearly didn't want to eat the hospital food, but he also didn't want her touching his IV line. "The food here is garbage," he muttered. "I know it's not great," Angela agreed. "But right now, it's what we have. How about I see if I can get you some crackers and peanut butter? That might be easier to get down." He looked surprised that she was trying to accommodate him, rather than just force him to eat what was already there. While she was gone getting the crackers, Angela took a moment in the hallway to collect herself. His words had stung more than she wanted to admit, and she found herself wondering why she was putting herself through this. But when she returned to his room, she noticed something that made her pause. Mr. Harold was sitting up straighter in bed, and he was looking out the window for the first time since she had entered. The afternoon sunlight was streaming across his face, and she could see how thin and frail he really was. "Here we go," she said, setting the crackers and peanut butter on his tray table. "This should help bring your blood sugar up." He ate slowly, and Angela used the quiet time to check his other vital signs. His blood pressure was elevated and his pulse was irregular. She made notes in his chart, aware that he was watching her write. "What are you writing about me?" he asked suspiciously. "Just your vital signs and the fact that you ate some crackers," Angela replied honestly. "Nothing personal." Over the next few hours, Angela returned to check on him several more times. Each visit followed a similar pattern. He would make rude comments, she would respond professionally, and she would complete whatever medical task needed to be done. But something was starting to change. The comments were becoming less frequent, and sometimes she caught him watching her work, with what looked almost like curiosity. During her evening round, Angela found him struggling to reach his water pitcher. Without thinking, she moved to help him, and for the first time, he didn't tell her to go away. "Thank you," he said quietly, so quietly she almost didn't hear it. That night, around 11 o'clock, Angela was walking past his room when she heard a strange sound. She stopped and listened. It sounded like someone was in distress. She knocked softly and then entered the room. Mr. Harold was sitting on the edge of his bed, breathing heavily and holding his chest. "What's wrong?" she asked, immediately moving to his side. Can't catch my breath," he gasped. Angela quickly checked his pulse and blood pressure. His heart rate was elevated and irregular. She helped him lie back down and raise the head of his bed to make breathing easier. "I'm going to give you some oxygen and call the doctor," she said, reaching for the oxygen mask. For the first time since she had met him, Mr. Harold didn't argue or complain. He let her place the mask over his face and even squeezed her hand. When she told him to breathe slowly and try to relax, Dr. Peterson arrived within minutes and examined Mr. Harold thoroughly. After adjusting his medications and ordering some tests for the morning, he stepped outside the room with Angela. "His heart rhythm is off," Dr. Peterson explained, "probably related to his diabetes and the stress on his system." "Good catch, Angela." Angela returned to the room to check on Mr. Harold one more time before her shift ended. She found him lying quietly with his eyes closed. She thought he was asleep until he spoke without opening his eyes. "I thought I was having a heart attack," he said softly. "Your heart rhythm was irregular, but you're stable now," Angela replied. The doctor adjusted your medications. He opened his eyes and looked at her. For the first time, there was no anger or hostility in his expression. Just an old man who had been scared. You could have left, he said. After the things I said to you today, you could have just walked past my room. Angela adjusted his blanket and checked his oxygen levels one more time. Mr. Harold, I became a nurse to take care of people. All people. Even the ones who don't think they want my help. He was quiet for a long moment, and Angela thought the conversation was over. But as she was turning to leave, he spoke again. I don't understand you, he said. And there was something different in his voice. Something that sounded almost like wonder. Angela paused at the door. What don't you understand? Why you came back? Why you helped me tonight? After everything I said, she looked back at him. This frail old man who had spent the day trying to hurt her with his words, and she felt something shift in her chest. Not pity exactly, but something close to understanding. Because that's what we do for each other, she said simply. We show up even when it's hard. As Angela walked out of the hospital that night, she couldn't stop thinking about the look in Mr. Harold's eyes during those last few minutes. It was the look of someone who was starting to question everything he thought he knew about the world. Angela walked into Mr. Harold's room the next morning expecting the usual cold reception. But something was different. Instead of the angry glare she had grown accustomed to, he was sitting up in bed looking out the window, and when she entered, he actually made eye contact. Good morning, Mr. Harold, she said, setting down his medication tray. How are you feeling today? Better, he replied, and his voice lacked the sharp edge it had carried before. That thing with my heart last night, it scared me. Angela began preparing his morning medications, organizing them in the small paper cup. That's understandable. Heart problems can be frightening, especially when you're already dealing with diabetes. She expected him to make some cutting remark about not needing her medical opinions, but instead he watched her work with quiet attention. You've been a nurse for a long time, he said. It wasn't really a question. 15 years, Angela replied, checking his blood pressure. Started right, out of nursing school and never left. Why did you become a nurse? The question surprised her. Yesterday he had questioned her qualifications and education, and now he seemed genuinely curious about her career choice. My grandmother was sick when I was young, Angela said, wrapping the blood pressure cuff around his arm. I spent a lot of time in hospitals with her, and I saw how much difference a good nurse could make. Not just with the medical stuff, but with making people feel less scared and alone. Mr. Harold was quiet while she took his blood pressure. When she finished, he asked, Did she get better? Your grandmother? No, Angela said softly. She passed away when I was 16. But the nurses who took care of her in those last weeks, they made such a difference for our whole family. I wanted to be able to do that for other people. I'm sorry, he said, and he sounded like he meant it. Angela looked at him with surprise. This was the first time he had shown any kindness or consideration since she had started caring for him. Thank you, she said. That means a lot. As the morning progressed, Mr. Harold continued to surprise her. When she brought his breakfast tray, instead of complaining about the food, he asked if she had eaten anything yet. I usually grab something from the cafeteria during my break, Angela said. The food down there any better than this stuff? He asked, poking at his scrambled eggs. Angela laughed. Not really. Hospital food is pretty much the same everywhere. You have kids? He asked suddenly. 2, Angela replied. A daughter in college and a son in high school. College, Mr. Harold repeated thoughtfully. What's she studying? Pre-med. She wants to be a doctor. For a moment, something flickered across Mr. Harold's face, an expression Angela couldn't quite read. That's good, he said finally. We need more good doctors. Throughout the day, their conversations became longer and more personal. Mr. Harold asked about her family, her education, and her experiences as a nurse. Angela found herself sharing stories she rarely told at work. My son plays basketball, she mentioned while checking his IV line. He's hoping for a scholarship. Is he good? Really good. His coach thinks he has a shot at playing in college. Basketball's a tough sport, Mr. Harold said. Requires a lot of discipline and teamwork. Angela nodded, struck by how normal this conversation felt. Yesterday she couldn't have imagined having a pleasant chat with this man about her children. During her afternoon round, Angela found Mr. Harold staring at a photo on his bedside table that she hadn't noticed before. It showed a younger version of him with two small children, a boy and a girl. "Your grandchildren?" she asked. His face darkened. "My kids. This picture is about 30 years old. They're beautiful children. Do you see them often?" Mr. Harold was quiet for such a long time that Angela thought he wasn't going to answer. When he finally spoke, his voice was barely above a whisper. "I haven't seen them in over 10 years. Angela felt her heart sink. She had wondered why he had no visitors, why no family members had been contacted when he was admitted. "That must be very hard," she said gently. "It's my fault," he said, still staring at the photo. "I said things, did things, guy, that I can't take back. They got tired of trying to have a relationship with me." Angela sat down in the chair beside his bed. "What happened?" Mr. Harold set the photo down and looked at her with eyes full of regret. "I was angry for a long time. After my wife died, I became someone I didn't recognize. I blamed everyone else for everything that went wrong in my life. I said terrible things to people who didn't deserve it. When did your wife pass away?" 12 years ago. Cancer." His voice cracked slightly. "She was the best person I ever knew. Kind to everyone, no matter who they were or where they came from. She would be ashamed of the man I became after she died." Angela felt tears prick her eyes. This was a side of Mr. Harold she hadn't expected to see, vulnerable and full of remorse. "It's never too late to change," she said softly. "Isn't it? My kids won't even take my phone calls. My son lives about 2 hours from here, and my daughter is in California. They both have families of their own now, grandchildren I've never met. Have you tried reaching out recently?" Mr. Harold shook his head. "What would I say? Sorry, I was a terrible father and a bitter old man for the last decade. Some things can't be fixed with words." Angela thought about her own children, how she couldn't imagine not speaking to them for 10 years. "Maybe they're waiting for you to try. Maybe they miss you too. I don't deserve their forgiveness. Maybe that's not for you to decide," Angela said gently. "Maybe that's up to them." That evening, Angela noticed that Mr. Harold seemed restless. He was picking at his dinner and staring out the window as the sun set over the city. "You okay?" she asked. "I keep thinking about what you said earlier, about it never being too late to change." "What about it?" "I look at you," he said, turning to face her, "and I see everything I taught my children to be suspicious of, everything I blamed for my problems. But you've shown me more kindness in 3 days than I've shown anyone in years." Angela felt a lump form in her throat. "Mr. Harold." "No, let me finish," he said. "I was wrong. About everything. About you, about people who look like you, about the world in general. I've been carrying around all this anger and hatred, and for what? It didn't bring my wife back, it didn't make my life better, it just made me lonely and bitter." He paused, struggling with his words. "I don't know how to fix what I've broken. I don't know if I can. But sitting here, watching you take care of me even after the horrible things I said, I want to try." Angela reached over and gently squeezed his hand. "The fact that you want to try is a good start. Will you help me?" he asked, and there was something almost childlike in his voice. "I don't know how to be different. I've been angry for so long I don't remember how to be anything else." "Of course I'll help you," Angela said. "But Mr. Harold, the real work has to come from you. I can't change your heart for you." "I know," he said. "But maybe having someone believe I can change will make it easier." As Angela left his room that night, she felt something she hadn't expected when she first took on his care. Hope. Hope that people really could change, that it was never too late to choose kindness over anger. and that sometimes the most difficult patients were just people who had forgotten how to let others care about them. Angela arrived at work the next morning to find Mr. Harold sitting up in bed, fully dressed in his hospital gown, with a notebook and pen in his hands. He looked up when she entered, and she could see an intensity in his eyes that hadn't been there before. "You're up early today," she said, setting down his morning medications. "I couldn't sleep," he replied. "I've been thinking about everything we talked about yesterday, about changing, about my kids, about a lot of things." Angela noticed the notebook was filled with his handwriting. "What are you working on?" Mr. Harold hesitated, then held up the notebook. "I'm trying to write a letter to my son, but I don't know what to say. How do you apologize for 10 years of being a terrible person?" Angela sat down in the chair beside his bed. "What have you written so far?" "Nothing good," he said with a frustrated sigh. "I keep starting over. Dear Michael, I'm sorry. Dear Michael, I know you hate me. Dear Michael, your father is an idiot." Nothing sounds right. Despite the serious nature of the conversation, Angela found herself smiling slightly. "Maybe you're trying too hard to fix everything in one letter. What if you just told him how you're feeling right now?" "Right now I feel like a fool," Mr. Harold said honestly. "Like I've wasted years being angry at the wrong people for the wrong reasons." That might be a good place to start. As Angela prepared his medications, Mr. Harold watched her with the same intense attention she had noticed the day before. But today there was something different about the way he was looking at her, something that made her slightly uncomfortable. "Angela," he said slowly, "can I ask you something personal?" "What is it?" "Where did you go to nursing school?" "City Community College." "Why? And after that, did you do any additional training?" Angela paused in her work. These were oddly specific questions. "I got my bachelor's degree in nursing from State University a few years later, and I've done continuing education courses every year to keep my license current." "Mr. Harold, why are you asking me this?" He was quiet for a moment, then set his notebook aside. "Because I've been watching you work for the past few days, and I need to tell you something." There was something in his tone that made Angela sit down. "What is it?" Mr. Harold took a deep breath. "I wasn't always just a bitter old man complaining about everything. Before I retired, I was a doctor. I practiced medicine for 42 years. Angela felt her eyes widen in surprise. "You're a doctor?" "Was a doctor. Retired about 8 years ago." He looked down at his hands. "And Angela, in all my years of practice watching medical professionals work, I can tell you that you are one of the most skilled, knowledgeable, and competent nurses I have ever seen." Angela didn't know what to say. She certainly hadn't expected this revelation. "The way you handle medications, the way you assess symptoms, the way you caught my heart rhythm problem the other night," Mr. Harold continued. "Your clinical skills are exceptional. Better than some doctors I worked with." "Thank you," Angela said, still processing this information. "But I'm still confused about why you're telling me this." Mr. Harold's face crumpled, and suddenly he looked every one of his 78 years. "Because I need to confess something to you. Something that's been eating at me since yesterday." Angela waited, sensing that whatever he was about to say was important. "When I first saw you walk into my room, I made assumptions about you based on your race. I thought you probably weren't as educated or as skilled as the white nurses. I thought the hospital was giving me substandard care by assigning you to me." Angela felt her chest tighten. She had suspected as much, but hearing him say it out loud still hurt. "But that's not the worst part," Mr. Harold continued, his voice barely above a whisper. "The worst part is that I spent my whole career making those same assumptions, 42 years of practicing medicine, and I let my prejudices affect how I treated black medical professionals." He paused, struggling with his words. "There were nurses like you, Angela. Brilliant, dedicated, skilled nurses who knew more about patient care than I did, and I dismissed them. I questioned their judgment. I made their jobs harder because I couldn't see past my own ignorance." Angela felt tears beginning to form in her eyes, but not for the reason she expected. These weren't tears of hurt or anger. They were tears of recognition, of finally understanding the depth of his guilt and shame. There was one nurse in particular, Mr. Harold said, his voice shaking now. Her name was Ruby. She had been working in our cardiac unit for 15 years when I started there as a young doctor. She tried to tell me that one of my patients was showing signs of complications, but I ignored her advice because I thought I knew better. What happened? Angela asked softly. The patient died. A man in his 50s with 2 young children. Ruby had been right about the signs she was seeing, but I didn't listen to her because of my prejudices. If I had listened, if I had valued her expertise the way I should have, that man might have lived. Angela reached over and took his hand. Mr. Harold, it wasn't the only time, he continued. Over the years, I saw talented black doctors and nurses leave our hospital because of the way they were treated. Some of them left medicine altogether, and I did nothing to stop it. I was part of the problem. Is that why you've been so angry? Angela asked. Mr. Harold nodded. After my wife died, all that guilt came rushing back. Instead of dealing with it, instead of trying to make amends, I became even more bitter. I blamed everyone else for the problems in the world because I couldn't face the fact that I had been part of those problems. Angela sat quietly, absorbing everything he had told her. She thought about all the challenges she had faced in her career, all the times she had to work twice as hard to prove herself, all the subtle and not so subtle discrimination she had encountered. Why are you telling me this now? She asked. Because watching you work, seeing your skill and compassion, especially after the way I treated you, it forced me to confront the truth about myself. You represent everything I failed to see and appreciate during my career. Mr. Harold looked directly at her, his eyes filled with tears. Angela, you are an extraordinary nurse. You have the kind of clinical instincts and patient care skills that can't be taught. And the fact that you showed kindness to someone like me, someone who represents everything that made your job harder over the years. I don't deserve your compassion, but I'm grateful for it. Angela felt overwhelmed by the weight of his confession. Mr. Harold, we all make mistakes. The important thing is that you recognize them now. But it's too late to fix most of them, he said. Ruby retired years ago. The patients who suffered because of my prejudices are gone. The talented medical buy. Professionals who left because of the toxic environment I helped create. I can't undo any of that. Maybe not, Angela said gently. But you can make sure it doesn't happen again. You can use your experience to help other people understand what you've learned. Mr. Harold squeezed her hand. Will you help me figure out how to do that? Angela looked at this broken man who had finally found the courage to confront his past, and she knew that helping him find a way to make amends was exactly what she was meant to do. Yes, she said. I'll help you. Over the next 2 weeks, Angela watched Mr. Harold transform into someone completely different from the angry man she had first met. Every morning when she arrived at his room, she found him working on something new. Sometimes it was letters to his children. Other times he was writing detailed notes about his experiences as a doctor and the lessons he had learned too late. I finished the letter to Michael, he told her one morning, holding up several handwritten pages. Would you mind reading it? I want to make sure it sounds genuine. Angela took the letter and began reading. In it, Mr. Harold wrote honestly about his anger after his mother's death, his prejudices during his medical career, and his deep regret over the years they had lost. But most importantly, he wrote about how meeting Angela had opened his eyes to the person he wanted to become. This is beautiful, Angela said, wiping away a tear. It's honest and heartfelt. I think your son will appreciate your honesty. Do. You really think he'll respond? Mr. Harold asked nervously. I don't know, Angela replied honestly, but I think you'll regret it forever if you don't try. That afternoon, Angela helped Mr. Harold walk down to the hospital mailbox to send the letter to his son. His health had improved significantly over the past week, and Dr. Peterson was talking about discharging him soon. I'm scared, Mr. Harold admitted as they walked slowly down the hallway. What if he doesn't want to hear from me? Then at least you'll know you tried, Angela said. But Mr. Harold, if I were your son, I think I'd want to know that my father had changed, that he recognized his mistakes and wanted to make things right. They mailed the letter, and Mr. Harold spent the rest of the day anxiously waiting for something that wouldn't come for days. Angela tried to distract him by helping him work on his other project, a detailed account of his experiences as a doctor and the importance of recognizing unconscious bias in medical settings. "I want to share this with other doctors," he explained, as he wrote. "Maybe it can help them avoid making the same mistakes I made." "That's a wonderful idea," Angela said. "Have you thought about reaching out to medical schools? They might be interested in having you speak to students about this." Mr. Harold's eyes lit up. "Do you think they would listen to an old man who admits he was wrong about so many things?" "I think they'd listen to someone who has the courage to admit his mistakes and wants to help others do better." 3 days later, Angela arrived at work to find Mr. Harold on the phone, tears streaming down his face. Her heart sank, thinking something terrible had happened. "Mr. Harold, what's wrong?" she asked, rushing to his side. He looked up at her with a smile brighter than any she had seen from him. "It's Michael," he said, holding up the phone. "My son," he called. Angela felt her own eyes fill with tears as she watched this reunion unfold. She could hear a man's voice on the other end of the line, and while she couldn't make out the words, the tone sounded warm and emotional. "He wants to come see me," Mr. Harold whispered to Angela during a pause in the conversation. "He's driving up this weekend with his wife and kids." After Mr. Harold finished his phone call, he spent the next hour telling Angela everything his son had said. Michael had been hurt and angry for years, but he had also missed his father terribly. He had been waiting for some sign that his father wanted to change, wanted to rebuild their relationship. "He said he's proud of me for reaching out," Mr. Harold said, wiping his eyes. "Proud of me? I haven't heard those words in so long." "I'm proud of you too," Angela said. "It takes real courage to admit when you're wrong and try to make things right." That weekend, Angela worked an extra shift so she could meet Mr. Harold's family. When she arrived at his room Saturday morning, she found it filled with people. A man in his 40s who looked just like a younger version of Mr. Harold was sitting beside the bed, while a woman and 2 teenagers stood nearby. "Angela!" Mr. Harold called out when he saw her. "Come here. I want you to meet my family." The man stood up and extended his hand to Angela. "You must be Angela. I'm Michael. Dad has told us so much about you." "All good things, I hope," Angela said with a smile. "The best things," Michael replied. "He says you saved his life, not just medically, but in every way that matters." Angela felt herself blush. "Your father did the hard work himself. I just reminded him that it's never too late to change." She spent a few minutes talking with the family, watching as Mr. Harold beamed with pride while introducing his daughter-in-law and grandchildren. The teenagers were shy at first, but Mr. Harold patiently answered their questions about his time in the hospital and told them stories about his recovery. As Angela was leaving to check on her other patients, Michael followed her into the hallway. "I wanted to thank you," he said. "I don't know what you did or said to my father, but he's different. The anger that consumed him for so many years, it's gone." "He's a good man who lost his way for a while," Angela replied. "Sometimes people just need someone to believe they can change. Will you stay in touch with him after he's discharged? I think your friendship means everything to him." Angela smiled. "Of course. Your father has become very special to me, too." The following week, Dr. Peterson officially cleared Mr. Harold for discharge. His diabetes was under control, his heart rhythm had stabilized, and his overall health had improved dramatically. "I think having something to live for again made all the difference," Dr. Peterson told Angela. "Family visits, plans for the future, a sense of purpose. Sometimes the best medicine isn't medicine at all." On his last day in the hospital, Mr. Harold presented Angela with a thick envelope. "What's this?" she asked. "It's a letter I wrote to the hospital administration," he said. "About you. About the exceptional care you provide and how you changed my life. I also included a recommendation that they implement better diversity and inclusion training for all staff." Angela opened the envelope and began reading. The letter was 3 pages long and detailed every aspect of the care she had provided, praising her clinical skills, her compassion, and her professionalism. But more than that, it told the story of how her kindness had transformed a bitter, prejudiced man into someone who wanted to do better. "Mr. Harold, this is too much," Angela said, feeling overwhelmed. "It's not enough," he replied. "You gave me back my family. You gave me back my life. This letter is just the beginning." He handed her another envelope. "This is for you personally. Don't open it until I'm gone." 3 months later, Angela received a call from Michael. Mr. Harold had peacefully passed away in his sleep at his son's house, surrounded by family. He had spent his last months visiting medical schools, sharing his story with young doctors and nurses, and working with diversity training programs at hospitals. That evening, Angela finally opened the personal letter Mr. Harold had given her on his last day. Inside was a check for $50,000 and a note that read, "Angela, this money is for your son's college education. You showed an old man that it's never too late to change and that kindness can overcome even the deepest prejudice. Please, use this to help your son become the kind of doctor I should have been. With endless gratitude and love, Harold." Angela sat in her kitchen, holding the letter and crying tears of gratitude, remembering the angry, bitter man who had become one of the most important people in her life. She thought about how he had spent his final months making amends, helping others, and proving that people really can change when someone believes in them. The next day, Angela framed Mr. Harold's letter of recommendation and hung it in her locker at work. It served as a daily reminder that every patient, no matter how difficult, deserves compassion and care. And sometimes the most challenging patients are the ones who need healing in more ways than one.